If you're interested in alternative birthing methods, this video is going to go over the 3 top different settings in the United States for giving birth, how those settings can influence the experience, what the staffing would be like in different settings, and answer some interesting questions around safety. I'm Allison Lorne. I'm a certified nurse midwife, and I have over 20 years of experience in the field of delivering babies. My work now focuses on helping people recover from difficult and traumatic childbirth experiences. Please download my free postpartum care checklist or visit my website to learn more about my offerings. First, we're going to talk about hospital births. That's where the majority of people are delivering in the United States. Then we're going to talk about home birth, and lastly, out-of-hospital freestanding birth centers. I'll go into what that all means when we get there. So first, let's talk about hospital birth. About 98% of people are delivering in hospitals these days. You could be attended by an OBGYN, a family practice doctor, or a certified nurse midwife. Sometimes midwives that aren't certified nurse midwives can also deliver in hospitals that have granted privileges to those midwives. The primary attendant at the hospital deliveries is an MD, an OBGYN. That's where we see the most deliveries. And then after that, family practice doctors. What's interesting is that nurse midwives deliver less than 10% of deliveries, but they are the most well-trained in normal delivery. So when we're talking about medical education, it is a very long path to becoming a doctor. You're going to get a bachelor's degree, you're going to get to medical school, and then you're going to do an internship or even a fellowship to advance your practice in OBGYN. A lot of that education is focused on how things can go wrong. It's focused on delivering care to highly complicated and acute patients that may have all kinds of other diagnoses like heart disease, kidney disease, diabetes, and all of that's going to factor into how you're cared for in the hospital. I'm a nurse midwife, so I am trained in normal delivery. Through extra training, I've added on some higher risk expertise as well, but the bulk of my training is in normal delivery. And for that matter, if you're wanting to get a normal delivery, if you're wanting to avoid a C-section, especially if you're wanting an unmedicated birth, asking and seeking for a nurse midwife in the hospital is really going to give you the best chance at getting that kind of an outcome. Midwives have lower C-section rates in general across the board. Add a doula on top of that, and your risk for C-section decreases even more. So doulas are usually privately employed. Some hospitals do have programs where perhaps AmeriCorps volunteer, a doula program is set up at the hospital, and you might have a doula assigned to you if you ask for one. But the majority of doulas are going to be paid out of pocket. This investment is so worth every penny. A doula is usually under $1,000, more around $400 or $500 for a delivery attendant. They will be on call, come to the delivery. Some doulas just focus on postpartum, on coming home after you have the baby and helping you with breastfeeding support and housekeeping. Even there are some doulas that are specialized in sleep patterns and helping babies learn how to get better sleep habits. That can be so important in protecting parents in those early days if sleep is really becoming so difficult that it's creating more stress and can be a huge contributor to postpartum depression in addition to that. So doulas are wonderful. Midwives are incredible. And of course, I love doctors. Every time I come to the edge of my skill set and I need a doctor, I want a doctor to come in and help me and work with me collaboratively. There's plenty of times where I completely step back and turn into the role of support in order to just help facilitate the doctor doing their work. And these are situations like perhaps complicated deliveries where forceps or vacuum might be indicated. That might be like you're pushing really hard for a long time getting the baby close to delivery and the heart rate goes down and we need to get that baby out right away, that will be one of the times I'll call a doctor in. There are some midwives that can do forceps deliveries for that matter, but for the most part, it's an extra skill. And again, we are specialists in normal birth. For that matter, there's a lot of midwives that will go into the operating room with you for emotional support and or have the extra skill set to do what we call first assist. And that is scrubbing in and being in the surgical field with the doctor. And that's always been really fascinating to me, actually being on the surgical side of things as well. So, hospital deliveries, look, it's where the majority of people are delivering their babies. It's where primary insurance programs will generally reimburse for deliveries. And in the hospitals, you're going to have a larger variety of interventions that could be offered to you. And a lot of these interventions are wonderful and really indicated and really advanced ways to help monitor mom, monitor the baby. Some of these interventions are ones that we try to avoid. If we're looking for a real natural delivery, unmedicated delivery, we're often trying to avoid an induction if possible. We are often trying to avoid Pitocin, avoid even artificial rupture of membranes when they break your waters. So there's a lot of interventions that aren't indicated. They're just used very commonly in common fashion and common practice to help move labor along. And when you're wanting a natural birth, a lot of these interventions are going to increase the chance and likelihood of needing pain medicine and or surgery like a C-section. So when people start using Pitocin, we often see the need for pain medicine increase. And that can be IV pain medicine or an epidural. And when we get epidurals, we see increased rates of C-sections also. So I'm trying to paint this picture of this cascade of interventions, the hospitals where you're going to have the most interventions. It's a great place to be if you're high risk to begin with, but just being in the hospital increases your risk of having a C-section, of having these other interventions. There's ways to advocate for yourself in that setting. One, by getting a midwife, and two, by employing a doula if you're able to do so. Furthermore, in other videos, I'm happy to go into birth plans and how you can advocate for yourself in the hospital setting to get a more natural delivery. So now I'd like to talk about home birth. Around 1% of the population in the United States uses home birth. The majority of attendants at home birth are what we call direct entry midwives. There are certified nurse midwives that do home birth, but the majority of home births are attended by direct entry midwives and also referred to as licensed midwives. These midwives are often licensed by the state in which they practice in, and these midwives often come in pairs, either a midwife and a student midwife, or a midwife and a doula, or two midwives. And you ideally want to have two people there. When the baby's born, you essentially have two patients, mom and baby. And if both need attention, it's nice to have the extra set of hands there. Certainly at home birth, we have a lot of partners get in and actually do the deliveries themselves if they're comfortable doing that. There's more variety in deliveries like water birthing, which also can happen in hospitals, but just not as often. In home, you'll have a lot of water births. You'll have this more patient-centered experience. The monitoring of the baby in labor is one of the biggest differences in home versus hospital delivery. And in the hospitals, we do continuous monitoring generally. And at home, we do intermittent monitoring. And that's when we use a Doppler to listen to the baby. Happy to go into that more in a different video as well. The one thing I find that's the most special in a home birth is being able to tuck mom and baby into bed together afterwards. And it's just such a beautiful feeling. I just got tickled talking about it because it's so wholesome, and it's the most beautiful way to promote bonding. In the hospital, there's a lot of assessments. There's a lot of interventions about even giving the baby their vaccines, some eye ointment, weighing the baby. All of this is happening like right after delivery, somewhat unnecessarily so. And at home birth, there's a real emphasis on having the baby skin to skin, establishing breastfeeding, and doing these assessments within the couple hours following delivery. But it's not this rush to handle the baby like what happens in the hospital. So my experience with home birth, I first started doing deliveries in the late 90s. And my first experience, the first birth I ever witnessed was a home birth. And that was by design. I was in nursing school and I was apprenticing with home birth midwives in Northern California. And I knew I wanted my first birth to be a home birth. I'd read so much and studied so much about it that I understood the difference in the model of care between hospital and home birth. There's really just so much more to be said for what is an intact experience. Mom, baby, dad, siblings, family, all in the room together, all being able to interact and support one another. Really seeing the team, the medical team, the midwifery team as an extension of this circle. These are people that you've come to know through the prenatal period. They are friends of yours. They may almost feel like family at this point. Birth is incredibly intimate, and home birth really helps hold that space of intimacy. Now, home birth is generally out of pocket. It can be $2,000 to $3,000, and even maybe up to $4,000 or $5,000, depending on where you're at and the level of services that are offered. Midwives will usually come back and check on you 24 hours, and then 72 hours later, check on the baby, see how the baby's doing, and you're in close contact. They're on call for you if you have any concerns about baby feeding, breathing, temperature, anything like that in the days following delivery. In other countries, the midwifery model is the primary model of care, and hospital births are reserved for those that are high risk. I wish that we saw more of that in this country. And of course, if consumers are out there asking for it, asking for their insurance companies to reimburse for these deliveries, we'll see more of it if it's consumer driven. Now, the last thing I'd like to talk about is freestanding birth centers. About like half of 1% of the population in the United States delivers in freestanding birth centers. Now, the word freestanding means that it's not affiliated with a hospital. A lot of hospitals will have birth centers, and that just means it's like a wing attached to labor and delivery, but it's not a freestanding birth center. The hospital birth center is still going to have a lot of that hospital culture and a lot of the amenities of the hospital, a lot of ability to get to the operating room, a lot of standardized procedures, but some differences, more perhaps water births offered and less IVs in those birth centers. When we're talking about the freestanding birth center, it's kind of like the midpoint between the home birth and the hospital birth. The freestanding birth center is generally staffed by midwives, both certified nurse midwives and licensed midwives. We see higher reimbursement from insurance for freestanding birth centers. We see a little bit more monitoring of baby. Again, the intermittent monitoring with some options for continuous monitoring. But if a baby is going to need to be continuously monitored because we've seen some variations in the heart rate that are concerning, then what we do is transport those patients to the hospital. Just like a home birth patient could be transported to the hospital if there's risk factors that develop in labor. Same thing for the birth centers. Those patients can be transferred to the hospital as well. Like freestanding birth center births also have that sense of intimacy. You'll have a lot of low lighting. You'll have a lot of limited staff. It's not going to be a lot of turnover. There's not going to be a lot of strangers coming in. It's just going to be you and your family and the birth center staff. Again, these are regular providers you've seen throughout the pregnancy, less providers in general to meet. So birth center staff certainly have more than just one midwife. but you'll generally meet everybody and have like some familiarity with everybody. You'll have gone to the birth center normally for your prenatal visit, so you have a level of comfort in the setting versus like the hospital. You get there, you might go on a tour during your childbirth class, but just get there when you're in labor. And just the change in scenery can be a disruption for your labor progress. The birth center is going to feel more comfortable. It's going to feel more like home, less equipment on the walls, and more amenities like birth tubs and pools that help encourage you to labor in the water and even give birth in the water. So there's so much more to say about all these different settings, and I'd be happy to go into more, especially if you leave a question below. I'll know how to speak to your interests in particular. Yeah, I have always loved being around birth. It's just a phenomenal experience, and my work now really is focused on helping people recover from difficult and traumatic childbirth experiences. When I was working in the hospital, which is where the majority of my career actually delivering babies did take place, I saw so many people having really traumatic experiences and being sent home without enough support and follow-up. I want to offer that support and follow up to people now. So through my coaching, through my online groups, through my workbook, you can find all of that in the links in description, and visit my website, please, to hear more and read more about me and the work I offer. I'm Allison Lorne, and this is Holistic Birth Recovery.